Mrs. Trout?
Yes.
The nurses are about to do bedside report. Do you need to use the restroom or need anything?
No, I'm good.
Okay, they'll be in a moment.
Okay. Come in.
Hello, Mrs. Trout.
Good morning.
All right, I'm going home now, so Glenda will be your nurse for today and tonight. She was my mentor when I was a new nurse, so you're in very good hands, and she'll take very good care of you today. Glenda and I are going to perform bedside shift report so that Glenda knows all the information that needs to know to take care of you today.
Okay.
Do you want your husband to remain in the room for this conversation, or would you prefer him to leave?
He can stay in there.
Okay, it'll just take a few moments. Please listen carefully, though. Feel free to ask any questions at any time, okay? All right. Okay, ready?
Mm-hmm.
All right, Mrs. Trout is a 65-year-old female, full code. We want to double check her armband and birthday and stuff.
Sherry Trout, 1/2 of 1983, CPR.
Okay, great. She is a patient of the BMTU service, and she was admitted last night with a WBC of 120 with no need for leukapheresis, and she is stable but monitored for a blast crisis. Patient came to us from Reynolds Hospital. Mrs. Trout has a history of hypertension, hyperlipidemia, diabetes, and GERD. She's on a diabetic diet. She had a sinus infection for a month, and they drew blood to find that she has high WBCs. Mrs. Trout's CT and EKG were completed and were both negative. She will have a baseline echo at 10 a.m. this morning and then go to the dental clinic at 1 p.m. She will also have a bone marrow biopsy at 3 p.m. and the doctor has started her on allopurinol and normal saline, which is going at 100 milliliters per hour. And I just changed the tubing this morning and labeled it.
Okay.
All right. She does have vascular access, but there is a consult for PICC line placement today as well.
What's a PICC line?
A PICC line is a peripherally inserted central catheter. It helps us to draw blood and can stay in longer than a peripheral IV can.
Okay.
All right. Mrs. Trout has a benign assessment besides her WBCs. Her vitals were ordered Q4 and have been stable. Patient is on continuous telemetry running, sinus tach, and her heart rate at 116 and is 95% on room air. She has remained afebrile. She will be having a workup for her hematologic malignancy and has a 20 gauge in her right AC, which was placed upon admission. Her last bowel movement was yesterday on January 3rd. Is that correct, Mrs. Trout?
Yes, that's correct.
All right. Be sure to tell the PICC team about her busy schedule today. She is on a sitter select because she was flagged as a high fall risk upon her admission. And we want to double check to make sure that's on.
Yep.
All right. She gets up with one person assist. Ms. Trout, do you have any questions?
No.
Is there anything else Glenda needs to know about caring for you today?
I don't think so.
All right. Thank you very much, Mrs. Trout, for allowing me to take care of you tonight. It was my pleasure.
No, thank you.
All right. You guys have a good day.
Thanks. Ms. Trout, are you having any pain right now?
No, I'm not having any pain.
Okay. I'm going to go get a report on the rest of my patients, and then I'll be back to assess you and administer some medications before you have your echo. Do you understand the plan of care for today?
Yes, and I'll be waiting on you when you get back.
Perfect. If you need anything, here's your call bell. Just press that big red button and we'll come in, okay?
All right, thank you.
All right. I'll see you in a little bit.
Okay.